This lecture is on the general physical examination. This session connects four chapter objectives. We will start with the purpose of a general physical exam, then look closely at the medical assistant's role before, during, and after the visit. After that, we will cover the safety precautions that keep both the patient and the care team protected. We'll finish with how to prepare a patient for the exam both emotionally and physically. As you listen, keep this big idea in mind. The provider performs the exam, but the medical assistant sets the stage for it to go smoothly. Your preparation, communication, attention to safety directly shape the patient's experience and the quality of the information the provider can gather. By the end, you should be able to describe why exams are done, explain your role, list the key safety steps, and prepare a patient with confidence. Here are the lecture's four outcomes. First, you will identify the purpose of a general physical exam, which means knowing why a provider orders one. Second, you will describe your role as the medical assistant during that exam. Third, you will explain the safety precautions used to protect everyone in the room. And finally, you will carry out the steps to prepare the patient, which covers both emotional readiness and physical positioning. Notice that the first two outcomes build your understanding, while the last two ask you to apply that understanding through real skills. Keep these four numbers in mind because the slides that follow are organized to match them in order. Let's start off by defining what the general physical exam actually is. It's a head to toe evaluation of a patient's overall health, and the providers order it for one of two broad reasons. The first reason is to confirm an overall state of health. Think of the annual wellness visit. The patient feels fine, and the goal is to verify that they are well, establish a baseline set of measurements, and catch anything early. The second reason is to diagnose a medical problem. Here, the patient comes in with a symptom or complaint, and the exam helps the provider investigate and explain what is going on. The important point for you as the MA is that the tools and techniques are largely the same in both cases. A stethoscope, blood pressure cuff, and careful inspection are used whether the visit is preventative or problem focused. What changes is the provider's intent and what they expect to find. Knowing the reason for the visit helps you prepare the right room, the right equipment, and the right level of support for the patient. Patients arrive for a physical exam for many reasons, and these often overlap. The most common is wellness and prevention, the routine checkup that keeps a patient healthy. Closely related is health screening, where the provider looks for conditions that may have no symptoms yet, like high blood pressure or elevated blood sugar. Establishing a baseline matters too. When you record normal values today, the care team has something to compare against if the patient becomes ill later. Of course, many visits are about diagnosing a complaint. The patient has a symptom, and the exam helps the provider explain it. Clearance exams, such as pre employment and sports physicals, confirm that a person is healthy enough for a specific activity. Finally, monitoring and follow up visits track a known condition or check how a patient is responding to treatment. As the medical assistant, knowing the reason for the visit helps you anticipate what the provider will need and how to prepare the patient. You might be wondering what your role is as the medical assistant during this exam. The key concept is a dual focus. You are supporting two people at the same time, both the patient and the provider. On the patient side, you provide physical comfort and protect privacy. You offer emotional reassurance with clear explanations, and you help with practical tasks like gowning, positioning, and draping. On the provider side, you prepare the room, equipment, and supplies before the visit. You anticipate what the provider will need and hand off instruments smoothly. You'll also document findings and keep the workflow moving. Notice how these two roles connect. When the patient is calm and properly positioned, the provider can work efficiently. When you have the room ready, the patient spends less time waiting and feeling exposed. A successful exam is really the result of you balancing both sets of needs throughout the visit. Making the patient comfortable has two sides, physical and emotional, and you attend to both throughout the visit. On the physical side, small things matter. Adjust the room temperature and lighting, offer a gown, blanket, or pillow, and help the patient on and off the exam table safely to prevent falls. You also position the patient for the specific type of exam and keep them draped so only the area being examined is exposed. On the emotional side, communication is your most powerful tool. Greet the patient warmly and by name, and use simple, direct language rather than complicated medical terms. Explain what will happen and why, because a patient who knows what to expect is far less anxious. Answer questions, acknowledge concerns, and always protect the patient's dignity and modesty. When you handle both kinds of comfort well, the patient relaxes, cooperates, and the exam goes more smoothly for everyone. Assisting the provider follows a natural rhythm that we can think of in four steps. First is preparation. Before the patient ever enters, you ready the room, set out the equipment, and stock the supplies the provider will use. Second, think provide. During the exam, you keep materials within reach and hand off items as the provider asks for them. Third is anticipation. This is the skill that separates a good MA from a great one. You watch the exam and predict the next instrument or supply so the provider rarely has to ask. Fourth is documentation. You record findings accurately and keep the overall workflow moving. The payoff is shown at the bottom of the slide. When you anticipate needs well, the exam is efficient and the patient spends less time in an uncomfortable or exposed position. Smooth assistance is good for the provider and kind to the patient at the same time. Safety starts with standard precautions. The guiding principle is simple. You treat every patient as if they could carry an infection, regardless of diagnosis or appearance. Two practices form the foundation. The first is hand hygiene, which the CDC calls the single most important step in preventing the spread of infection. Clean your hands before and after every patient contact. In most clinical situations, an alcohol based hand rub is preferred, but when your hands are visibly soiled, you wash with soap and water for at least 20 seconds. Always clean your hands immediately after you remove gloves because gloves can have tiny defects. The second practice is gloves and other personal protective equipment. Wear gloves whenever you may contact blood or body fluids, and add a gown, mask, or eye protection when splashes or sprays are likely. Match the level of protection to the task and the exposure you expect, and always remove and discard your personal protective equipment carefully so you do not contaminate yourself. These two habits protect you, your patient, and everyone else in the clinic. Beyond hand hygiene and PPE, four more measures round out exam room safety. Respiratory hygiene and cough etiquette protect against germs spread through the air. Encourage patients to cover coughs and sneezes, offer masks and tissues at entry, and keep symptomatic patients separated from others in the waiting area. Isolation precautions, also called transmission based precautions, are an extra tier used when a patient has a known or suspected infection. These are layered on top of standard precautions and depend on how the germ spreads. Biohazard waste disposal keeps contaminated material out of regular trash. Sharps go in puncture resistant containers, and other contaminated items go in labeled biohazard bags. Finally, you clean and disinfect the exam room and equipment between patients. A surface that looks clean can still carry germs, so following your facility's cleaning schedule and using the right disinfectant is essential. Together, these steps break the chain of infection at several points. Let's look now at how we prepare the patient both emotionally and physically. We'll start with the emotional preparation. The goal is to lower anxiety and build trust because a patient who feels informed and respected will cooperate far more fully with the exam. Start by using simple, direct language. Explain each step in plain words and avoid medical jargon that can confuse or frighten a patient. Tell the patient what to expect. When you describe what will happen and why before it happens, you remove the fear of the unknown. Invite and answer questions. Give the patient room to speak and respond honestly and kindly, even to questions that seem small. Finally, respect culture and modesty. Patients bring different values, beliefs, and comfort levels, and adapting your approach shows respect and earns cooperation. Emotional preparation does not take long, but it shapes the entire visit. A few reassuring sentences from you can turn a tense patient into a calm and willing partner in care. Physical preparation is the hands on half of patient preparation. It protects comfort, privacy, and safety while positioning the patient so the provider can see and examine what they need to. Think of it in three pillars. The first pillar is comfort and privacy. Provide a gown and proper draping, expose only the area being examined, and protect privacy by closing doors and curtains and knocking before you enter. The second pillar is safe positioning. Assist the patient on and off the table to prevent falls, position them for the specific exam or procedure, and support them while watching for any sign of distress or discomfort. The third pillar is adapt and verify. Modify your techniques to meet the patient's needs, gather the correct supplies and instrument for the planned exam, and confirm the patient is ready before the provider enters the room. When you handle all three pillars, the provider walks into a room that is set up for success and a patient who is comfortable, covered, and correctly positioned. The final piece of patient preparation is adapting for special patients. Your goals of comfort, privacy, and safety never change, but the method you use to reach them does. With pediatric patients, involve the caregiver, use simple words a child can understand, and allow extra time and reassurance to build trust. With mobility limited patients, offer transfer help and choose positions the patient can tolerate safely rather than forcing a standard position. With older or fragile patients, move slowly, prevent chills by keeping them covered, and watch closely for fatigue or dizziness, especially when they change position. With anxious patients or those with special needs, explain calmly, reduce noise and stimulation, and adjust your pace to match what the patient can handle. In every case, you read the patient in front of you and modify your approach. That flexibility is the mark of a skilled and compassionate medical assistant. In summary, remember that a general physical exam is done either to confirm a state of health or to help diagnose a medical problem, and the same tools serve both purposes. On your role, it's a dual one. You support the patient with comfort and communication, and you support the provider by preparing, anticipating, and documenting. For safety, it rests on hand hygiene and personal protective equipment, then adds respiratory hygiene, isolation precautions, biohazard waste disposal, and cleaning and disinfecting the room. For preparing the patient, you do so emotionally with simple, clear language and physically with comfort, privacy, and correct, safe positioning, adapting your methods for special patients. The single sentence at the bottom captures it all. The provider performs the exam, but the prepared and attentive medical assistant is what makes it work. Carry that mindset into every patient encounter. If you're interested in learning more about this topic, here are the references I used to put this lecture together.